Welcome back to Have More Babies. We're here to really break down specialized health research, giving you those critical insights you need quickly.
Exactly, so you can stay informed.
And today, our focus is on a pediatric health issue that honestly often flies under the radar. We're talking about uveitis.
Hmm. And it needs attention because, well, the outcomes can be really serious. But the tricky part is the symptoms. They can look like everyday things, maybe allergies or just pink eye.
That's the danger, isn't it? The sources we've looked at, these comprehensive pediatric guides, they actually call it an unseen peril. And when you think about a child's health, their vision is just so fundamental. Uveitis attacks the very structure of the eye.
Right.
So our goal here is to pull out those key signs, the things needed for early detection, maybe even intervention.
Okay, let's unpack this, starting with, what is uveitis fundamentally?
Okay. So fundamentally, you need to understand the eye structure a bit. Uveitis is inflammation, specifically inflammation of the uvea or the uveal tract.
The uvea, that's
Right.
the middle layer, right? That's it, the middle layer. It might sound a bit technical, but its job is absolutely vital.
So it's not just surface stuff like conjunctivitis.
Oh, definitely not. Think of the uvea as, well, like the eye's main supply line for nutrition. It includes the iris, the ciliary body, the choroid.
Okay.
Its whole purpose is getting oxygen and nutrients to the retina and the lens, the parts you really need for sight. So if that structure gets inflamed,
Then that supply line is choked off or damaged.
it's basically both. And that's why it's so serious. The inflammation itself, the swelling, the fluid, it can physically damage things like the retina, the optic nerve. You can even see secondary problems like cataracts or glaucoma, yes, even in kids.
Wow.
And at the same time, as the sources point out, without those nutrients, the sensitive tissues just start to, well, fail. That's why every resource we looked at hammers home the need for early intervention, because vision loss can happen fast if it gets severe or chronic.
Okay, that really clarifies the stakes, which brings us straight to the causes. And this
Yeah.
is where uveitis almost acts like a detective for the body, doesn't it?
It really does.
We need to know what triggers it, because often the eye issue is the first clue that something bigger is going on systemically.
Yeah, the eye is almost like an immune sensor. Looking at the sources, the causes tend to fall into three main buckets. We can call it the trio of triggers.
All right, the trio. Let's start with the big one, the one that gives us that systemic link. Autoimmune disorders.
Yes. This is probably one of the most significant takeaways here. The body's immune system messes up. It starts attacking healthy tissue, and the eyes often get caught in the crossfire.
Right.
And the sources really highlight a strong link, specifically with juvenile idiopathic arthritis, or JIA.
Okay, and here's where it gets really interesting for parents, I think. Because you'd assume joint pain comes first, then maybe eye problems later.
That's the common assumption, yeah. But the research actually flips that sometimes.
Really?
Yes. What's often missed is that with certain types of JIA, the uveitis might have no symptoms for a while. Or it could actually show up before any joint issues are obvious.
So an eye doctor checking for inflammation might actually be the first one to suspect a major rheumatic disease.
Precisely. It means regular eye exams aren't just about checking vision for glasses. They're part of monitoring for serious systemic diseases. That eye inflammation isn't just a side effect. It could be a predictor.
That's a huge insight. Okay, what are the other two triggers in this trio?
Second one is infection. This is a broad category. Could be bacterial, viral, fungal. Any of those can set off uveitis.
And finding the specific germ is key for treatment, I imagine.
Absolutely. Because you need antivirals for a virus, antibiotics for bacteria. It means doing, detailed blood work, maybe cultures, not just a quick look.
Makes sense. And the third trigger, a reminder about safety.
Trauma. Simple physical damage. A hit to the eye, something sharp. Any injury can start that inflammatory cascade in the uvea. And this one is often preventable.
Right, so autoimmune, infection, trauma. Beyond those main three, the sources also mention risk factors, things that make someone more susceptible.
Yeah, definitely. There's genetic predisposition. So if autoimmune disorders run in the family, you need to be more watchful
Okay.
than environmental factors like maybe exposure to certain toxins that could stress the immune system. And lastly, immunocompromisation. That could be from a chronic illness or even from medications needed for other conditions that suppress immunity.
So the big picture here is that uveitis is rarely just an isolated eye problem, persistent inflammation. It probably means you need a full medical workup, connecting the dots between the eyes and the rest of the body.
Exactly. Looking for that underlying issue.
So since it's often tied to something internal, the symptoms might be subtle at first, What are those specific persistent signs that should make a parent or doctor think, okay, this isn't just a passing irritation?
Right. This is the really practical part. Catching it early is everything. But like we said, it's tough because it can mimic other things. Pink eye from a cold usually clears up fast. Uveitis symptoms, they stick around. They often get worse.
Okay, let's nail down those 5 key indicators. What signals act now?
First, persistent eye redness. Not just a little pink for a day. We're talking redness that lingers, maybe looks deeper, closer to the iris, not just on the white surface like typical pink eye.
Got it. Persistent redness. What's next?
Second, mild to severe eye pain. Now, kids get little aches, but this is often described as different, like a deep ache, a throbbing, maybe pressure behind the eye.
Any complaint of actual pain, not just itchiness, is a definite red flag. What about changes in vision itself?
Okay, third is photophobia. That's extreme sensitivity to light. If a child suddenly starts really squinting in normal light, avoiding the sun, hiding their eyes, that's a big sign of internal inflammation.
Okay, light sensitivity. Number 4.
Fourth is blurred vision, just things looking fuzzy, not sharp. This can be hard for little kids to explain, right? But older kids might say things look blurry or like they have shadows.
Okay, blurriness. And the 5th one often points to something happening deeper inside the eye.
That's right, floaters. Seeing little specks or like cobwebs floating around in their vision, that's basically debris, inflammatory cells drifting inside the eye's jelly, the vitreous humor.
So persistent redness plus any of those others, pain, light sensitivity, blurriness, floaters, that's the combo that screams, get this checked immediately.
Exactly, that's the signal to act fast.
So we see the signs. A parent brings the child in, or maybe the pediatrician notices it during a checkup. How does the diagnostic process actually unfold? What's the roadmap?
Well, the first step is always that comprehensive ophthalmic examination. The eye doctor needs special tools, like a slit lamp, to get a magnified view inside the eye. They're looking for those tiny inflammatory cells in the fluid at the front of the eye.
But since we're thinking systemically, it doesn't stop there, does it?
No, not at all. Because of that potential link, the investigation widens pretty quickly. The next really crucial step is blood tests.
Okay, what are they looking for in the blood?
The sources are clear on this.
Yeah.
They're hunting for signs of that underlying problem. So specific markers for inflammation, things like ESR and CRP, these show if there's inflammation happening generally in the body.
Right.
And often they'll test for specific autoantibodies too, like ANA anti-nuclear antibodies.
Yep.
Those are strongly linked to autoimmune stuff like JIA. These tests help confirm if it's systemic.
And you mentioned imaging earlier, the OCT. Why is optical coherence tomography so important here?
Yeah, OCT. It's amazing, actually. It's non-invasive, uses light waves, and gives this incredibly detailed cross-section view of the retina.
Like layers.
Exactly. It lets the team see precisely what damage the inflammation might be causing inside.
Right.
Is the retina swollen? Is there fluid built up? How far has it spread? It's essential not just for diagnosis, but for tracking how the disease is progressing and, importantly, if the treatment is working. It's like a detailed map of the damage.
Wow. That whole process, the eye exam, the specific blood test, the detailed imaging, really highlights how seriously this needs to be taken. Okay, so once uveitis is confirmed, what about treatment? What are the main approaches the sources talk about?
Treatment really has two jobs. Shut down the inflammation fast and deal with whatever caused it in the first place.
Right.
So for more acute or less severe cases, the first thing they usually try is anti-inflammatory medications. Typically, these are steroid eye drops, often pretty high potency. You use them frequently to get that local inflammation down quickly.
But steroids have side effects, and what if it's chronic or tied to something like JIA? The sources mention needing more, right?
Exactly. Steroid drops might not be enough, or maybe you can't use them long term. For those tougher cases, or the ones clearly linked to an autoimmune disease, doctors have to escalate. That usually means immunosuppressants.
So medications that calm the whole immune system down.
Right. They work systemically throughout the body to stop the immune system from attacking the uvea. This often means the eye doctor needs to work really closely with, say, a pediatric rheumatologist.
A team approach.
Definitely. And then, going back to infections, if they trace the uveitis back to a specific bug,
Then the path is clear.
then it's targeted. Antibiotics or antivirals. You treat the underlying infection directly, and that should resolve the inflammation in the eye. Figuring out that why is absolutely key to choosing the right treatment path. Local drops, systemic immune meds, or anti-infectives.
Okay. So what does this all mean for prevention? If we know it's often systemic, how can we be proactive about protecting a child's vision?
Well, proactive steps fall into, I'd say, three main areas. First, and this is maybe the most important, regular eye checks.
Just routine exams.
Yes. The sources really emphasize this. Regular comprehensive eye exams are the best way to catch those early subtle signs before they get bad. Especially crucial for kids who already have a known risk, like a family history of autoimmune disease or a JIA diagnosis.
Okay, regular checks. Second, seems logical based on the causes.
Manage underlying conditions. If a child has JIA or another autoimmune issue, keeping that primary disease under control is huge. Good management medication, lifestyle, whatever's needed helps prevent uveitis flare-ups, which often happen when the systemic condition isn't well controlled.
Makes perfect sense. And the third prevention step goes back to one of those trigger.
Safety measures. Simple, right, but so effective.
Protective eyewear.
Exactly. For sports, maybe even yard work, anything where there's a risk of getting hit in the eye. Preventing that physical trauma just eliminates one whole pathway to getting uveitis.
It really comes down to timely diagnosis and effective treatment, often looking beyond just the eye itself, to protect that child's vision and their quality of life.
And that comprehensive view, that whole body approach, it's actually reflected in the resources we looked at. They don't just talk about eyes. They mention integrating eye health with things like obesity medicine, lactation services, even after-hours care.
That's a really powerful point. It underscores that something like uveitis, which could be tied to inflammation, immunity, general health, it often needs that multi-pronged approach. You might need to address nutrition, overall health, those underlying conditions, to truly manage the eye inflammation effectively.
Yeah, the best defense against these complex conditions is definitely knowledge and having that comprehensive medical team on your side.
Absolutely. So if you found this helpful and maybe you're looking for more details on uveitis or newborn care, managing those underlying issues, or any of the services we touched on, we have a clear next step for you.
Yes. For really solid information and resources from the kind of experts whose work informed our discussion today, we strongly, strongly encourage you to visit omegapediatrics.com.
That's omegapediatrics.com. It's really your go-to resource for digging deeper into these pediatric topics and making sure your child gets that full spectrum of care. And while you're processing all this, maybe do us a quick favor, like this discussion if it was valuable, subscribe to the channel for more deep dives into important health topics.
And please share this information. Share it with another parent, a caregiver, anyone you think might need to know about this.
Thank you so much for joining us on Have More Babies.
Remember, understanding the whole picture, that's your best defense.
We'll catch you on the next deep